Hola a todos y muy buenos días. Bienvenidos.
Good morning to all, and welcome to this weekly press briefing here at the Pan American Health Organization on COVID in the Americas. My name is Sebastián Oliel with the Communications Department here at PAHO, and let me remind you that we have simultaneous interpretation into English and Spanish, and you can choose to use it through the interpretation button. This session will last between 45 minutes and 60 minutes, and we will be accepting your questions up to the end. We have already received questions via email, and you can also ask your questions through the chat button, the Q&A button in Zoom. Please include your name and the media outlet when asking the questions today. PAHO's director, Dr. Carissa Etienne, will be informing you about the situation of the pandemic in the region and also on the role of the health systems beyond COVID. We have here Mr. Jarbas Barbosa with the director, who is the assistant director, Mr. Ciro Ugarte, director of Health Emergencies Department, also with PAHO, Dr. Marcos Espinal, director of the Department of Communicable Diseases here at PAHO, and Dr. Sylvain Algieri, deputy director for Health Emergencies and Incident Manager for COVID-19. Now I would like to ask Dr. Etienne to offer the opening remarks. Dr. Etienne, the floor is yours.
And a very good morning to all of you, and thanks for joining today's press briefing. Our region remains under the tight grip of this pandemic. As of August 3rd, the Americas had over 9.7 million cases and over 365,000 deaths. And these numbers continue to rise. Nearly every country in Mesoamerica is witnessing spikes in COVID-19 cases, with many countries grappling to manage the spikes. Across the Caribbean, countries have managed to control their initial outbreaks, but most have recorded new cases and must remain vigilant as they reopen their borders and face tropical storms. There is an overall increasing trend in the Andean subregion and in Brazil. Chile presented a big peak in the May-June time period and has been declining since. Argentina, however, is reporting an increase in less populated provinces outside of the capital, Buenos Aires. Latin America is facing what we can refer to as a public health paradox. Many countries are reporting record numbers of new infections, a clear sign that the virus is still rapidly spreading. Yet, there is mounting pressure to open economies and schools and continue life as usual. COVID-19 will not go away anytime soon. This pandemic is a reality that we need to adjust to by continuing to actively implement measures to control the virus and by using data about the virus spread and the state of our health systems to calibrate our actions. The pandemic is also not the only health issue that we face. We are beginning to see warning signs of the devastating impact that the pandemic has had on other diseases. We know from experience that natural disasters and health emergencies can fracture and quickly overwhelm health systems, often with grave consequences. During the recent Ebola outbreak in the Democratic Republic of Congo, the health system struggled to contain the over 6,000 Ebola cases that were spreading across the country. And so as a result, other services were deprioritized and scaled down. As a result of the disruptions in the vaccination program, 340,000 children were infected with measles. And the impact of these disruptions can last months or even years. Looking closer to home, in the months following Hurricane Maria, Puerto Rico reported significantly higher death rates than previous years. Today, we are at risk of history repeating itself. Within every country in our region, health workers are being redirected to care for the influx of COVID-19 patients. Many of them have gotten sick themselves as they tend to those in need. And without doctors and nurses available to offer other essential services at the first level of care, such as pregnancy-related care and management of chronic conditions like diabetes or infectious diseases, such as HIV, TB, and malaria, these services are severely disrupted, or worse yet, halted entirely. At the same time, patients who are sick or who think they might be sick are hesitant to seek care for fear of COVID-19 infection, or because transportation disruptions and lockdowns have made it harder to reach their local clinics. Some may even assume that care is not available and postpone the help they need, often worsening their health situation. Additionally, our clinics and hospitals are still struggling to stock their shelves with the medicines and personal protective equipment that they need, as the pandemic has strained global supply chains and slowed global trade. Today, 11 countries within the Americas have less than 3 months' supply of antiretrovirals. If these are not replenished soon, people living with HIV may have to interrupt their treatment. Meanwhile, some countries will run out of tuberculosis medication within the next 3 months, and the reagents that they need to diagnose TB in half of that time. Running out of these supplies is simply not an option. We cannot allow this to happen. We don't yet know the full extent of the problem because disease surveillance has been severely disrupted also across more than half of our region due to a lack of lab capacity, supplies, and/or personnel. PAHO is continuously monitoring the situation, and the data we do have is of growing concern. We conducted a survey with 27 countries that shows that half of diabetes programs and those designed to manage hypertension have been halted at the primary care level. In selected countries, pregnancy-related visits are down by 40% compared to the previous year, increasing the risk for pregnant mothers and their babies. Currently, there is a measles outbreak in Brazil, and we are monitoring cases of diphtheria in countries like Haiti and Venezuela, reminding us that protection against these vaccine-preventable diseases is more important than ever. And yet, more than a quarter of countries have suspended routine vaccination campaigns. We are also concerned about immunization levels. Our region was the first to eliminate polio and smallpox, a fact that we are very proud of. We do have the tools and the experience to maintain the highest levels of vaccine coverage. But weeks or months of disruption will increase the risk of outbreaks of vaccine-preventable diseases, reversing our long-standing trends in the region. A prolonged response to this pandemic must include the provision of other essential life-saving services. Countries must avoid thinking that they must make a choice between reopening economies and protecting the health and well-being of their people. Countries must adapt and commit to simultaneously providing these essential primary care services while at the same time mitigating the effects of COVID-19. Again, this is not an either-or choice. Rather, governments must strike that careful balance for public health. National leadership must create the pathway for the future. Over the last few months, PAHO has shared best practices and worked hand in hand with governments to make adjustments, whether big or small, to be able to do just that. There are two things that every country must do: re-engineer how essential care is delivered and invest in the first level of care. We are seeing many health systems embrace digital health, including telemedicine, so patients can continue to be monitored by providers from their comfort and safety of their own homes. In places where telehealth is not available, at-home visits and community outreach programs are supporting our most vulnerable populations. Our clinics and hospitals are drastically changing their routine by spacing our appointments and allocating specific areas or sometimes even entire floors to care for patients exhibiting COVID-19 symptoms, so that everyone else can safely receive medical attention without risking infection. While these small changes are important in the short term, this pandemic has clearly shown that significant investments in our health systems are long overdue and, I dare say, desperately needed. As PAHO has said before, now is the time for countries to dedicate 6% of GDP to strengthen their health systems. And the best and most efficient way to do this is by prioritizing the first level of care. If well-resourced, primary healthcare can bring nearly all of our patient needs under one roof, close to where they live and where they work. Countries can respond to COVID-19 by providing testing and contact tracing, while also offering other essential services like immunization, mental health support right there in the first level of care. An integrated approach saves patients time and resources while improving the quality of care that they receive. Primary healthcare investments also improve efficiency, reduce healthcare costs, and enable hospitals and communities to expand capacity in other areas of care. The COVID-19 pandemic has shown that for too many of us, health is still a luxury and care is out of reach. We must work together so that universal health is a reality for all and that no one is left behind. As we continue on this path towards universal health, we must ensure that our health systems are resilient and that they have the resources, the supplies, and the health workers that they need to fight a pandemic, while at the same time keeping people healthy and protected from other diseases. When left unchecked, these diseases may create other public health challenges that can be equally damaging to people's health. We must strike the appropriate balance, and we must do this together. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to start with the questions that we have received via email, and then we will have the questions that we are receiving through the Q&A chat. So please do continue writing us in English and Spanish, and please do identify yourselves with your name and media outlet. The first question that we have received reads:
Still at the epicenter of COVID-19 and the increasing acknowledgement of a protracted pandemic, what do governments need to keep at the forefront of their efforts? Dr. Etienne?
Thank you for this question. Let me begin by saying that universal access to health and universal health coverage remain a core tenet of health and development. And even in this time of crisis, where we must ensure that everyone, irrespective of their income, their ethnicity, or gender, has access to quality care when they need it without incurring financial hardships. Unfortunately, the pandemic has disrupted many essential health services, including programs that people depend on to manage conditions like chronic diseases, HIV, TB, and malaria. And as I said earlier, we're beginning to see that as a result of these disruptions, patients across our region are dying from these treatable conditions at a higher rate than normal. Today, the Americas are at risk of losing years of health gains in a matter of months. The COVID-19 challenge, of course, is without precedent in our lifetime. It requires strong and well-funded health systems to see us through this crisis and to allow us to recover. There is no doubt that countries need significant and sustained interventions to suppress COVID-19, to protect health gains, and to tackle mounting poverty and inequalities throughout the region. We must affirm that health is not a privilege nor a commodity. It is a fundamental human right. The health of our communities and the health of our economies depend on it. Over.
Gracias, doctora Etienne.
Thank you very much, Dr. Etienne. The next question is by Matias Lowell from MedPed Spanish. He's saying that in several occasions it has been said that this is the first wave of cases in the Americas, and he is asking, do you think that the peak has been delayed more than initially forecasted? Do you agree with the idea that instead of speaking about a first and second wave in Europe, we should be referring to a large wave that could have ups and downs? Dr. Barbosa, thank you. Thank you very much for this question, Matthias. I think that it is very important to understand that the transmission pattern that we have in Latin America is different from the transmission that we saw in Europe. In some countries, such as Italy, for example, Germany or France, we saw an explosion of cases, a very strong peak, but with strong social distancing measures adopted, these measures were very effective to attain after 4-6 weeks a downward trend for the cases, and this is a clearly defined first wave. In Latin America, the transmission is different. The measures adopted were important to reduce the speed, the pace of transmission, but they were not enough so far in terms of efficacy in most of the countries to control transmission and also to cause that curve that will flattened to levels of isolated cases only. In some cases, in some countries, this prolonged wave allows for some movement within the national borders, and we see that in some countries it is stronger than in others. We do need to monitor the situation. In Latin America, the trend is for a very strong transmission, and we need to maintain all of the measures to reduce this even more. Thank you very much. Thank you, Doctor. The next questions, we have several journalists that are communicating to us via email and the chat and asking also for the solution to the coronavirus problem. We see Oscar Ugarte Jimenez from Universidad Costa Rica, Dina Diester from AFP, and also Mr. Figueiredo from the state newspaper in Brazil. And Oscar is saying that over the last weeks, we have seen messages indicating that COVID may never have a solution or that we may never go back to normal life. We have heard this from health officials, and he's asking whether this is the right time to have a message such as this one when people are afraid, and if there is another way to face this type of message. Alina says the same, that WHO said on Monday that there may never be a final solution, and what is the impact this has on the fight against COVID in our region. And Ruda is also asking the same question, but also asking in particular whether this is related to the expectations in terms of a vaccine, or whether this is just a call to the countries to continue to implement the current control measures. Dr. Espinal, could you please address these questions? Thank you very much, Sebastian, and thank you very much to the journalists. It is very important to put the answers by the general director in context. What the director general said is that we need to continue with the measures. Dr. Barbosa clearly stated them, and what the director said is that it will take time. There are more than 160 vaccines that are being investigated. This is an important component, but we need to wait for the outcome. We need to remember, and I think that the Director General is also trying to say that this is a very famous virus for which we have not found a vaccine, HIV, for example, but it takes time, but we cannot think that because we have 160 candidate vaccines, we already have the solution. We need to wait for the results. And once again, the Director General is asking for us to continue with the mitigation measures to reduce that increased strain on our hospital beds, also pharmaceutical measures, social distancing, but we should not understand this, that there won't be a solution. There will be medicines, there will be potential vaccines, but until we have the results of the clinical trials, we cannot reach conclusions. And I think that this is what WHO is asking for all of us to continue with the measures. Very well. Thank you, Dr. Espinal, for your response. The next question is by Royston Jones from Bahamas, and it reads,
on how long COVID could affect the world. Earlier projections suggested 2 years. Dr. Aldiguieri?
Thank you for this question. As the question is coming from the Bahamas, I'd like, on behalf of the Pan American Health Organization, to express all the support from our organization, including our country office in Nassau, after the impact of Hurricane Isaias. So this question is important, and I think is in the top agenda of most of the decision makers worldwide. However, we have to say, as Dr. Espinal explained, as Dr. Barbosa alluded to, this is a new virus. Its secrets are not clearly characterized yet. What we know at the moment is that its dynamics is very different from a region of the world to another, from a country to another, and from a province or a department to another within the same country. What we know about the immunity in the population, I'm talking about the community immunity, is that even in the most affected areas, in the most affected countries, the percentage of the people, of the population with immunity is not enough high to protect against a new emergence of the virus. What we know at the moment is that the strengthening of the public health actions, of the public health interventions will take time. And again, Dr. Espinal has explained this. With the development of new tests, laboratory tests, for having a better surveillance at community level, the development of new treatments for managing the critical patients and reduce the mortality, and the development of effective and safe vaccines that can be deployed to remote areas. So in the context of all these aspects, I would say that the 2-year period is a logical time frame for having more tools, effective tools to reduce the impact on our lives and on our societies. Thank you.
Gracias, doctor. La siguiente
Thank you very
pregunta
much. The next question is by Bernex Exawar from FM 91.9 in Trinidad and Tobago, and it reads,
has had an influx of refugees from Venezuela and in recent time has encountered a spike in cases. What advice and/or support can PAHO give to territories that face COVID-19 infection risks because of porous borders? Also, these countries may need more testing sites and support to manage the refugee population. Has this been considered? Dr. Ugarte?
Thank you for the question. We've been highlighting the issue of migrants and refugees and also travelers in terms of their impact for COVID-19. But countries should maintain or strengthen as necessary their capacities at points of entry. So these include the capacities for entry and exit screening, early detection through active case finding, isolation and quarantine measures, etc. We have to consider that if we consider the migrants and refugees as the cause of the spike of COVID, most probably those populations will tend to hide their symptoms and may not go to health services. And that will impact the health services of the arriving countries. And we are seeing that increasingly in many cases. Just as we mentioned several times, the number of cases that are detected at the points of entry are very, very low in comparison with the number of cases that are detected inside the country. So management of the situation, particularly on strengthening surveillance and implementing protective measures to all those migrants and refugees, but particularly to provide them the testing, provide them the facilities for them to isolate or quarantine, etc., are part of the regulations of the international health regulations. They should not be charged for the testing. They should not be charged for all those additional measures. And actually, that benefits the countries, Trinidad and Tobago and many other countries that receive migrants and refugees and extension travelers will be better off if they provide all those benefits at the same level to their populations. That is a policy that was approved at PAHO for any other emergencies, and in this emergency, this is crucial. Thank you.
Muchas gracias, doctor. Vamos a pasar a la
Thank you very much. Now we are going to move on to the next question.
Tim Listener de CNN pregunta.
CNN is also asking a question related to what we received from Melina Ochoa from Mexico.
Some countries in Latin America would likely reach their peak of new infections in August. Do you still think this is the case? And how have your forecast estimates changed in the last few weeks? Melina pregunta muy similar para el caso de México.
Melina has a very similar situation for Mexico. Dr. Barbosa, could you please address this question?
You know that when we are making estimation, we are taking some models or forecasting that are based in other countries that have had the transmission before, Latin America. Of course, that we expect and we hope that the August is the peak. So the countries will achieve the control of the transmission. But we only can be sure of that after the control of the transmission. So we do encourage all the countries to make to adopt all the measures to review how the social distance measures can be more effective, how they can protect the poor families, how they can protect people that are workers of the informal economy, so they can have more adherence to the social distancing measures. This is the basic measure that they need to adopt in cities, states, or provinces where they are still experiencing the high numbers every day of new cases. So the peak probably we hope that will happen this month because the countries will work harder and will achieve the control of the transmission.
Gracias, doctor. Pasamos a la siguiente pregunta.
Thank you, doctor. Next question by email, but also now by chat. Juan Manuel Nievas, Argentina correspondent of Chinzuen, says Argentina had its first COVID-19 case on March the 3rd. What stock taking does PAHO do about the country's response to the pandemic? And he also asks, what is the reason that the fatality rate of 1.81% keeps in low levels? Dr. Espinel, thank you for the question. Argentina has been an example of good practice in taking very early measures. It even was one of the first countries in implementing a total quarantine in March, when many countries had not done so, and Argentina had few cases back then. And even though we see an increase of cases, fatality in Argentina is very low, 1.81%, similar to other countries that have also taken this is social distancing and quarantine measures. Argentina also has involved the governors of all the provinces, some of them from the opposition party. And this was a good message to the population. The government was well advised by the Association of Infectologists. There's an expert committee of immunologists. So the country has adopted joint measures so that despite the cases, the fatality is low. So the important thing is to prevent deaths. If we say that 80% of cases are slight or moderate and they recover, we will be doing our work if we prevent deaths. Maybe we should recommend to increase testing and continuing with these measures until we can achieve that, get to that peak and then come down. But this is, Argentina is an example of good practice. Thank you, doctor. We have several questions about the Dominican Republic. It's Felix Tejeda of the Libre newspaper, who asked, how does PAHO value the advance of COVID-19 in the Caribbean, and especially in the Dominican Republic and the Miami Herald in the chat?
In the Caribbean, and what is the current situation? Y Altagracia Ortiz de Hoy también nos envió una pregunta.
Altagracia Ortiz from Hoy also asks, saying that the high fatality and positivity figures in the country, overall the population does not respect the established regulations, and what recommendations would PAHO have for the new authorities that will assume on August 16th. Dr. Ugarte, can you take this question? Thank you. Thank you very much for this question. The Dominican Republic, after the closure of public activities, etc., went to a reopening relatively early. As of 20 May and in various stages. And in this process, we have seen that in the latest stages, there has been a significant increase in the number of cases in the Dominican Republic, and this is associated, as many questions have asked, and this is part of my response to a reduction of the risk perception, but also a relaxing of social distancing and of the strict use of masks. And this is an example for all countries, not just the Dominican Republic. It's important to say that when we have these effects, as in the case of the Dominican Republic, a state of siege, so to speak, was declared again on 21 July to implement stricter measures. So since August the 1st, we have seen several indicators about the attack and incidence rate, the positivity, and several indicators were affected, but the fatality rate has remained at a low level, around 6%. So it would be convenient to take measures in places where cases are concentrated to reduce the transmission. The new government has been in contact with our office and with the transition teams for the change of government and has received specific recommendations. But overall, we recommend to all countries strict measures to contain transmission in identified places by restricting mobility, strengthen contact tracing, strengthen laboratory work, and decentralize lab diagnostics and reduce the response times to confirm test results. All of these recommendations apply to all countries that are currently reopening and relaxing their economy. Thank you, Doctor. We have several questions by the chat having to do with hurricanes and pandemic. Sarah Newells from The Telegraph says
that hurricanes could worsen the pandemic. How concerned are you about a potential double whammy and what is being done to mitigate the risk? Y en el mismo sentido, André Paultre.
And along the same lines, André Salte from Reuters asks,
to be taken during the COVID-19 pandemic in the midst of the cyclonic period in countries like Haiti. What supports do PAHO offer? Doctor Aldiguieri, quizás pueda comenzar con esta pregunta.
Dr. Aldiguieri, could you address these questions, please?
Thank you for these questions. As you have, all the hurricane season in the Caribbean has already started. We have our second hurricane tropical storm, even impacting the eastern shore of the United States at the moment, and not very far from our headquarters here in Washington, at least this morning. So hurricane and tropical storms and natural disasters are a concern to PAHO. This is adding a new layer of complexity to the response to the public health emergency of COVID-19. We have to be prepared at different levels. This region has a long history of preparedness to natural disasters and hurricanes, for example, in the Caribbean, with special mechanisms, national mechanisms, subnational mechanisms, even sub-regional mechanisms. But with the COVID-19 situation, we have to be prepared for a set of new challenges in terms of population that would have to move to shelters with new challenges for implementing the social distancing, the hand hygiene, the wearing of masks. And so the shelters are one of the big concerns for Pan American Health Organization. And we have developed and shared guidelines for management of this kind of situation with our member states and the national authorities dealing with hurricane and natural disaster preparedness and response. One of the other concern is how hurricane will disrupt the care of non-patients in health facilities, including critical patients that require intensive care and oxygen therapy. And for these recommendations have been also shared during multiple phone calls and video conference with our member states regarding the establishment of to have plans for alternate sites in terms of healthcare facilities, plans for a surge in human resources, and very important, a close coordination between the different levels of the governments dealing as it used to be, with natural disasters and with the management of the COVID-19 response, which is managed, what we know, at the highest level of the government. Pan American Health Organization has a special program dealing with natural disasters, including hurricanes. We have a sub-regional office based in the Caribbean. Teams are ready to be deployed, and our country offices in many countries of the Caribbean are already activated, and I've received updates and briefing for working together with the national authorities in responding. Thank you.
Gracias, doctor. Las próximas preguntas que
Thank you,
nos llegan
doctor. The following questions have to do with the reopening of schools. Ana Lucia Ola of Prensa Libre from Guatemala, and also Michael Klotz from Depictions Media. Ana Lucia says that the UN has called upon the countries to prioritize reopening the schools as soon as they have controlled COVID transmission, because prolonged closures could provoke a generational catastrophe from the educational point of view. What would be the best moment to take that step? And have you seen new cases in countries that have reopened the schools? And also, what advice would you give to schools that reopen and to parents to be prepared when they send the schools back to their school? Dr. Barbosa. Yes, excellent question. It's a very important social topic. The UN Secretary General focused on this problem and said that it is very important to reopen schools as soon as transmission is controlled, as soon as possible. There are different experiences in different countries. The countries that reopened schools with a very strong community translation and had new outbreaks, but other countries that controlled community transmission were able to reopen schools with relative safety. So first of all, it's very important to control transmission, because if transmission is not controlled in each state and in each city, reopening schools can be a risk factor. Once the transmission has been controlled, schools can be reopened with physical distancing measures and having access for tests for students and teachers, and also with the use of masks and also hand washing. All of these measures are very important. All of this is very important to be taken in the process to reopen schools. First of all, you need to control transmission, and then, only then, establish a protocol to guarantee the security, the safety of students and teachers. Thank you very much. Thank you, Doctor. The next question in the chat comes from Elisa Martins from O Globo in Brazil. She would like to know, how does PAHO consider the situation of Brazil that shortly will arrive to the benchmark of 100,000 COVID deaths with no signs of abatement of the pandemic in a country that already had many problems before the pandemic. Dr. Espinel, could you respond to this question? We can't hear, doctor. Could you activate your microphone? Yeah, thank you. I think that Elisa said attaining 100,000 deaths. Yes, the situation in Brazil is still critical. We cannot claim victory. It is important to continue implementing the recommendations and the non-pharmaceutical measure packages that go in line with the recommendations of international organizations and of the international health regulations for case management, prevention, detection. And there is a slightly hopeful sign. On July 29, Brazil reported 79,000 cases. And in the last 5 or 6 days, this has gone a bit down. But it's very difficult because such a large country where, even though testing has increased, it still has remote areas and areas where the virus is still rampant, and we should not think that we are already flattening the curve there. We have to wait and see what happens in the next few weeks in Brazil. The important thing is that there are still communities, so in the federal districts, São Paulo, Salvador, that report large numbers of cases and of deaths. So we have to continue with the measures, and our offices are at Brazil's disposal, but it might well be that at some point the countries will be able to flatten the curve if they continue implementing non-pharmaceutical measures and also detecting and managing cases. Thank you very much. Thank you, doctor. Another question now coming from El Comercio from Quito, Gabriela Quiroz in Ecuador. She asks, how do you consider the transmission and mortality situation in Ecuador, considering that there has been quarantine from March to May, and then there has been a gradual opening with alert lights? Dr. Espinel, can you answer? Yes, Gabriela asked a very important question because Ecuador suffered a very severe impact, especially in Guayaquil. However, other places that had not been affected now see an increase in cases associated to the increase in the fatality rate in Ecuador. And this data shows simply that there's a lot of population susceptible to COVID, even in areas where there have been many cases. It is possible that some cities see an increase, a new outbreak, an increase in massive numbers of cases. And we see in Ecuador cases in provinces that originally had not had any cases, but also in provinces that had seen cases. And so it is very important to maintain all those measures that we already mentioned, especially the use of masks, social distancing, and hand washing. We will never insist enough on these measures. And this is not the authorities or the government's responsibility. It is up to each one of us. If someone gets the disease, falls ill, it will be probably due to the fact that that person did not implement correctly the measures. If someone loses its alertness, they will transmit the disease to their family, close relatives, or work colleagues. So these measures that we see in Ecuador apply to other countries also. The director mentioned in her opening words also, and we said repeatedly that the implementation of measures at an individual level to protect oneself and those who surround you is a responsibility that has to continue being up to each one of us in the next few months, not just days and weeks ahead, months ahead. Thank you. Thank you, Doctor. The next question in the chat comes from Daniel Mesa from Proceso Digital in Honduras. And he says, he asked, what lessons have we drawn so far about COVID-19 to apply to future epidemics? Dr. Barbosa, could you respond, please? Yes. Thank you, Daniel. All public health emergencies of international significance need to analyze what has worked and what needs to be reinforced so for us to be prepared for the next pandemic. And this applies also for this pandemic. We don't know when the next pandemic will hit, and we don't know what new virus will produce the next pandemic. Maybe it would be a new influenza virus or a new coronavirus, but right now we have the pandemics will be possible in the future, but we have an entire process with the SARS outbreak in 2003 that led to review the international health regulations for us to be more effective when it comes to detecting early a new pandemic. So we are still in the middle of the battle, but it's important that each country and each organization could conduct its revision process. WHO has already launched this assessment process, which is an effort because each pandemic, each public health emergency has lessons as to how to increase our resilience or how to increase our early response capability to have more effective responses to contain a transmission. We will undoubtedly have lessons from this crisis, which is the largest public health crisis in the last century. And this will be useful for each country because this is absolutely necessary to think about global health security, because each individual country has to have the capabilities to give an effective response. Thank you. Thank you, Doctor. The next question comes from Francisco More from Cover News in Argentina, and he says, is it possible that within a country or region that there could be different ways to address the pandemic? What is the risk of not having a common approach? Dr. Aldigueri, could you respond, please? Thank you for the questions. Many presenters today, Drs. Espinel, Barbosa, etc., have stressed that many countries are having a mosaic of different epidemiological profiles with different dynamics. First of all, I think that it's important to stress the need for a national coordination adapted to each country's administrative structure, including in federal countries, but the menu of public health interventions to respond to COVID has to be harmonized and even standardized. Some necessary tools as response pillars, such as surveillance and laboratory networks, need a strong centralized coordination having to do with technical standardization, provision of inputs, and surveillance. In a complicated market at the subnational level, we are recommending flexibility to implement public health measures with a breakdown of information established by local information systems such as incidence day rates, number of ICU beds, reproductive number, lab test results, etc. But communication is very important. Communication with the population that has to address the specific characteristics of each segment of the population, including the populations with different cultures and minorities. Thank you. Thank you, Doctor. The next question comes from Daniel Collins from TN23 in Guatemala. He says that Guatemala has exceeded 1,000 COVID deaths. It's the largest, the highest number in Central America, but with many children and young people among those 1,000 deaths. What message could PAHO have taken into account the structure and food characteristics of Guatemalan families? Thank you. Thank you, Sebastian. We know that COVID-19, or the virus that produces the COVID-19, is transmitted efficiently also among young people and children. However, with less complications and a lower severity. In Guatemala's context, where there are high levels of malnutrition, our call is that the country should ensure that vulnerable populations, especially rural populations, have access to health services on a comprehensive basis, and that health teams can reach those rural places to identify cases, to do contact tracing, and they may also help in the implementation of isolation or quarantine in very hard conditions. So they should ensure that the exposure to the virus could be reduced as much as possible so as to have a smaller impact. But I would like to say that in the case of Guatemala, the percentage of deaths among those of less than 10 years old is less than 0.7% of total deaths, and between 10 and 19-year-olds is close to 0.9%. Unacceptable, but anyway, low. It's unacceptable that a young person or even any people would die. And the fatality in the groups of children and young people is less than 1%. With this, I would like to stress that all populations are susceptible to contagion, and those who don't suffer a bigger impact, they might well transmit more disease through the opening of schools, but also measures, the lack of measures were in places where it's very difficult to implement quarantines and isolations, and children are in contact with people who have more risks, especially those more than 70-year-olds and people who have associated health conditions. Thank you, Doctor. The next question comes from Paulina Alcázar from Cadena News in Cancun, Mexico. And she says, within the despair of people to take care and the fake news about the false information in the social media about Clorox, in Bolivia has already accepted that for production and sales, and other countries are using this extensively. Paulina asked about what has been your experience in the consumption of this chlorine dioxide product. Thank you for the question. PAHO clearly and emphatically does not recommend the use of chlorine dioxide and of derivatives, either as an ingestion or an inhale or any other use in humans. This product is used to disinfect surfaces that are still are lifeless, not in human beings. There's no clinical test, no feasible result that suggests that chlorine dioxide and derivative products are effective. On the contrary, it's a gas, it's very toxic, with a very strong chemical reaction that can kill people, can provoke diarrhea, pneumonias, and other series of conditions. It is essential that when people hear that these products are offered, that they should contact their health ministry at their website. PAHO at its website has recommendations about not using this product. So this is a recommendation for all of our countries because there's no scientific evidence. And yes, there have been reports about intoxications and about adverse health situations that we want to avoid. So please, for God's sake, no one should use this product. Thank you. Thank you, doctor. We are coming to the end of the session today. One of the questions in the chat and also by email.
This is a question from Brazil. So,
y también Jacqueline Charles del Miami Herald preguntó, given that this pandemic has had a disastrous effect on economics, how are countries to pay for these investments that they have long been ignored even before COVID? Dr. Etienne?
Thank you, Sebastian, and thanks for this question. So let us be clear. Health systems in the countries of the Americas were, for a long time, historically underfunded and fragmented. And that was way prior to the arrival of COVID-19. So this is nothing new. Public health expenditure in our region stands at an average of 3.7% of GDP. And that is far less than what is needed to effectively address any disaster or pandemic, let alone one of the proportions that we are seeing with COVID-19. More generally, this underinvestment has a huge impact on being able to achieve universal health and impacting severely the first level of care. So to address this, PAHO urges all countries to increase public expenditure in health at least 6% of GDP. And we recommend that 30% of this investment would be directed towards primary care. But the question is, and rightly so, how can this be achieved? Countries need to address fiscal priority for health and strengthen or develop a financing model that ensures equity and sustainability. For example, universal public pooling mechanisms are starting to happen in some countries. And these systems, as we see, are being financed with contributions that are calculated according to people's ability to pay. Another way to obtain these additional resources to finance the health systems is to address the tax avoidance and to bring those that are working informally into the formal economy to broaden the taxpayer base. Because one common way of funding is through taxation, like the SUS in Brazil. And some countries have imposed what the excise taxes on tobacco products, alcohol, and junk food. And these resources are then directed towards health. So finally, I will state what is, I think, the obvious. Health is a good investment. Investing in health systems now will continue to reap rewards for the future, reducing preventable mortality, ensuring healthier populations, improving well-being, and preparing us for future outbreaks. Because COVID-19 is not the first, nor will it be the last outbreak that our countries will have to face. In the shorter term, however, we can be sure that those countries that make the investment in health now will surely bounce back better and faster than those that do not. So the underlying invest in health, ensure equity of access, and ensure quality of care within a context of sustainability. Thank you so much.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Thank you all for participating in this session. As usual, we will be sending you the opening remarks by Dr. Etienne, as well as the recording of this session. And let me remind you that you can find further information on PAHO's website, and we will continue in contact via email in case you have any questions. So thank you all, and see you next Tuesday.